Here we go. Welcome everybody to The Big Idea. I'm Dr. Jeffrey Hanna here at Clear Chiropractic, and today I'm going to be talking about TMJ disorders, specifically how it is that a TMJ can actually be the origin of low back pain and even foot pain. And I know that that sounds really weird. I'm doing this as a bit of an explainer video for a number of my own clients where when I'm doing an assessment for them, and yes, we're identifying problems with the spine, but looking at the difference between cause and effect. And that's really what we're always trying to answer. Where we have pain is not always where the problem is coming from. But oftentimes I need to explain to people how, yes, I think that there are certain pieces that I can help, but when I do an assessment, I'm finding that the primary issue of all things is their jaw, and I believe that that is actually the origin of some of the pain or the issues that they're having down in their low back. So I'm doing this video here so that I might be able to explain a little bit more about what's available in the research and how important it is, not solely from a chiropractic perspective, but believe it or not, from an orthodontic or a dental perspective about why you need to make sure that any changes you ever have done for your dental alignment, that it's going to be a way that's going to be healthy for your body as a whole. So let's have a look. Now, I'm actually going to start out with a very controversial statement here. It's a question of whether you should or should not have braces. Now, I am not an orthodontist, so I am not going to be saying what you should or shouldn't do. But there is something really important based on my own personal experience, but also my years in practice, a very important that you ever want to ask your dentist, your orthodontist before you would start a course of care. Simply put, you ask your dentist or your orthodontist, do you believe that the alignment of the teeth or the jaw can affect the body's posture? If the answer is no, you're in the wrong place. You want to make sure that you are working with a dentist and an orthodontist who understands those functional relationships. Now, I'm not wanting to throw the dentist under the bus here, because I would also say something similar but slightly different if and when you're ever working with somebody in my field as a chiropractor. You ask them, okay, what do you think is going on here? What then do you think some other possibilities could be that could produce the same symptoms? And if your chiropractor cannot answer that, same thing, you're in the wrong place. So I'll use me as an example. Let's say a person's describing that they have upper neck pain. Okay, so the question is, well, what are some other things that could cause neck pain? Okay, it could be a TMJ disorder. It could be a problem with your foot. It could be a problem with your eyes. It can be something going on with the circuitry of the brain or the balance. Or you get the idea. And so you have to go through a clinical series of tests to find out what do you actually have going on. Again, not just focusing on where the pain is, but what is producing that in the first place. So a very important question, again, that you want to ask a chiropractor, but you would also want to ask a dentist before you would ever start having orthodontic treatment. And that is whether as an adult or as a child. So I'm going to take you through a couple of research articles I've come across here. I'm not going to read these. I'm just going to break them down into their key components. I'll start with this study here out of 2025. The association between temporomandibular, so jaw disorders, and kinematics of the sacroiliac joint, a 3D motion analysis study. The sacroiliac joints, those essentially form the pelvis. They don't move very much at all, really only a few millimeters, but they are what is essential for providing the support for the rest of your frame. If these guys are ever not moving the right way for any number of different reasons, then it starts to produce more pressure into the discs of the low back, into the support of other ligaments, into the muscles, and then before you know it, people are starting to have low back pain, among a number of different other kinds of issues. Now, this is a relationship that I had learned a long time ago. If you're looking at the frame of the body, I had learned that there is a relationship between what's going on with the upper plane of the TMJ. So it's called the temporal bone. It's basically right here at that little spot of your ear, and these sacroiliac joints. In other words, where one goes, the other is going to go with it. But it's honestly very little evidence is out there. So I wanted to have a little look to see, okay, well, what evidence is there? So here's a study where they were looking at the most common type of TMJ disorder. Simply put, it's where the lower part of your jaw is shoved a little bit too far back into the socket right here. It's not a full ball and socket joint, but essentially if this was going to be, I'll come so you can see it like that. So let's say that this is the front side and then this is the back side. It forms a little hollow. So the jaw starts to slide backward here, and the consequence of that is that you have a little bit of a disc, kind of like the cartilage that's on the inside of your knee, but much thinner, much smaller. It starts to displace forward. That can start producing a lot of pain in this area, clenching, grinding headaches, especially if it's kind of like a fan on the side of your head right here, but also a clicking noise when you open and close your jaw. What these researchers did then was they had a look at 20 people with chronic TMJ and also 20 people who were otherwise healthy, normal. They didn't have any clicking or anything like that. And I'll just sort of glide it down a little bit here so that you can see what they did. There we go. They did a series of measurements to see how their jaw was actually moving. They were assessing, was it making a clicking noise when it was an opening and closing? And they used a bunch of computer sensors in and around the pelvis to see that if a person was upstanding and if they were leaning forward or leaning backward or a little bit side to side, was there normal motion of the sacroiliac joints? What they found was that if you have this condition with the jaw, where the jaw is shoved a little bit too far to the back, that the sacroiliac complex, it's essentially going to lock into a certain position that's going to prohibit the normal movement. And again, even though they don't move very much, if those joints do not move the way that they are supposed to, it puts more stress on the supporting muscles, more stress on the ligaments, and if they can start to stretch over a period of time, that can lead to a lot of different kinds of low back pain. Now, I'll use a silly little model here of the sacrum. So this would be where we're looking at the back side here. So when we're talking about the sacroiliac joints, we're talking about this guy. So the hip bone is essentially going to be like my hand that sits on the two sides like this. So when you are moving, when you're walking, it's meant to rock just a little bit like this. So what the researchers were finding is that if a person has a TMJ related disorder, that very characteristically, and I'll do it kind of like this here for you, that what you're going to see is that the sacrum is actually going to roll backward like this. And that starts to flatten the normal curve of the lower back. And at the same time, you'll have the hip bone start to roll forward like this. So the classic illustration that's used to describe this forward carriage of the hips, or an anteriorly rotated hip, is, of all weird characters, Donald Duck. So he basically, when he walks or when he waddles, it's like his hips are leaning super far forward and his butt's sticking out really far out of the back here. And that's happening because that guy goes backward, but in order to maintain the center of gravity, the entire pelvic complex then starts to roll forward like this. And so they're finding that people, when they have these particular TMJ disorders, there is a compensatory locking action that's actually occurring down through the pelvic joints. And it's the kind of issue that in particular is going to affect your ability to pull your knees up toward your chest. You'll probably find, and this is not meant like as full diagnosis, but as a way of assessing for this, is if you've got, you already know that you have a clicky jaw or something like that, that try to bend your knees up toward your chest. You probably find that one of them is a little bit more restricted, but at the same time, it feels more comfortable when you do that. And the reason for that could very well be that what you are actually doing is you've got this action that's occurring here at your hip bones, that when you're bending your knees up, it's actually allowing this to come back, which is allowing the stress and tension to come back out of the joints. Now, I was curious if the researchers here found any correlation to the side that a person may have a TMJ issue and other specific things. Does that correspond with the side of where the joint is actually locking up? Well, in this particular article, no, not really too much, but I did find another one that reported a bit of a moderate correlation, not an absolute, but a correlation to things. Let me show you that. So, only a couple years older, cause and effect relationships between painful temporomandibular disorder and postural and functional changes in the musculoskeletal system, a preliminary report. And this was actually a much more detailed study. It was really, really interesting. I'm not going to, again, read the whole thing through to you, but again, they're citing firstly this phenomenon that's been observed for a long period of time, that any one part of the body has the potential to affect the others. We talk about it in upper cervical chiropractic care, how misalignment of the top vertebra in the neck can affect and produce postural distortions that go all the way down the rest of the way into the upper back, into the low back, into the pelvis, all the way down into the foot. And yes, that is absolutely true. But there are also the dentists who are describing the same phenomenon going on when you have a problem of the TMJ. So what these guys wanted to see is, were there any correlations? So similarly, what they did was they had a look to see, okay, does a person have a locking jaw? Is it making a clicking noise? Anything like that? And then they also measured a whole bunch of different things in terms of a person's posture. Does the head have the tendency to come forward? Does the shoulders seem to tip? Does the pelvis seem to shift one way or the other? And they actually went all the way down, not just assessing a person's posture like this, but also assessing the way that they would put weight distribution through their feet. So just as a few examples that I'll illustrate for you right here, they would do a preliminary test on a person to see what their weight differential was, and then they would produce just a temporary little splint, essentially one of those little plastic football mouth guards that you just put in the boiling water and then set to the jaw. That's going to simply allow it to decompress without causing it to compress back up. And check out what they found. As an example, simply by altering the bite, you make a change all the way down into the balance of the foot, just like that. Or here's another example. Actually, here's quite a few more examples. You can have way too much weight distribution on one side. You can actually shift it completely over onto the other side, again, by changing nothing more than a person's bite. So here are all the rest of the numbers right here. We don't need to focus on that, but I wanted to highlight this particular one right here. There was a coexistence of sacroiliac joint locks in most patients, 29 out of 30 people. 29 out of the 30 people that they studied in this particular article right here, they found that if they had a TMJ disorder, they also had a locking of the sacroiliac joints. And again, it was a moderate correlation, but they found that most of the time, that if there was an irritation of the jaw on one side, that would be when you would have that particular locking mechanism of the sacroiliac joint on that same side. So, okay, is there research out there that supports this idea that the jaw can actually affect the sacroiliac joints? I mean, the short answer here is absolutely yes. We don't know the linear relationships solved 100%, but there are a few things that we do know. We do know that if the jaw goes backward on one side, number one, that's going to cause compensatory misalignment of the top vertebra and neck on the same side, where if jaw goes backward, the neck's going to go forward. Head's essentially going to drop down like this, body starts to come out like that, and that normally should produce a case where body's going to misalign in a certain way, and it seems to be that that is producing a compensatory forward misalignment of the hip bone, stretching the SI joint on that side and altering a person's weight differential. Now, in that second article that I showed you, they went on to say that because so many people have also had functional foot issues, or they could have one leg that's slightly shorter than the other, or other issues in the spine, as much as they try to screen it, that there are some wild cards that are involved. In other words, we can't assign linear values to things. But the reason that this is going to be important, and the kind of my closing remarks right here, and where this is very important, is for people, if they do have long-standing history of low back pain, particularly if they know with certainty that the sacroiliac joints are involved, but also then for pregnant women, an important consideration: have you had braces in the past? Remember what I said in the very beginning. You need to ask your orthodontist, do you believe that the bite can affect your posture? The answer, as we see in the research, is yes. Now, I'm not against orthodontics, but very important that if you are ever having any amount of dental work done that has the potential to shift the TMJ, and especially if you have a wire on your bottom jaw that's going to essentially be holding your teeth and holding your jaw in that same position, you need to be aware that if your teeth might be orthopedically straight but are not necessarily sitting in the right position, you get a clicking jaw, you get headaches, again, especially on the side right here, you've got sleep apnea, you snore, you have different things, and especially if you get low back pain. The jaw could be the driving factor in that. And as much as somebody like me might say, well, we can just adjust your neck or we can adjust your spine and it's going to be able to fix absolutely everything, that is not necessarily the case. It might be necessary to make sure, or have another procedure done to make sure that your teeth, your TMJ alignment is the way that it is supposed to. And the reason I say pregnant women and why this is important is because, like we just showed you, if you've got a locked TMJ, you're also going to have a locked sacroiliac joint. Through pregnancy, the ligaments are supposed to laxen. If, however, they remain persistently tight, that could make for a few complications, or at least a more higher probability you're going to have back pain episodes through your pregnancy, because your body would be fighting this kind of structural arrangement, this change. Something is holding it, locking it into position, when this is the point where it's actually supposed to expand. I do repeat, just because you might have had braces at a younger age, it does not guarantee that if you are pregnant, you're going to be having issues later on down the track. But simply put, an important consideration: if you've already had low back scans, you've had CT, you've had MRI, 60% of people over the age of 30 are going to have degeneration through the joints of their lower back. Many people, that's not the issues. But the sacroiliac joints, those are the guys that are absorbing huge amounts of the stress. Now, all of us are going to be sitting, standing, walking, doing that. So again, it doesn't mean that being a human being in and of itself means that you have to have low back pain. But it does mean that if there are these other factors in your medical or your health history that mean you have a smaller margin of error, you need to be more cautious and careful, and especially if you have already had all of the PT, all the chiropractic, all the acupuncture, all the massage, targeting your low back. And it feels good while you're having it done, but man, that thing just tightens straight back up. Very likely then something else is driving it. It could be the foot, could be the neck, but it could also be the TMJ, a very important consideration that we can never really forget about. So, bit of a mouthful, but thank you guys for watching that little rant of mine. As you know, if you watched any of my other videos, you know that I personally have had a TMJ disorder that's caused a lot of different things with my own health. So this is a topic that is very important, very dear to me, that I'm passionate about, because I don't want to see anybody have to go through the same kinds of challenges that I did. So if I can share any of the things in my own experience, any of the things that I've learned that can, even if I'm not the person to solve it, I can help direct you to get to the right person, I'll do that as very best as I can. So I need your help for that. Please, if you think this video is worth your time, please click that like, subscribe button. Also, arguably more important, share it with friends and family that you think would benefit from checking this out. And if you want some more information, please check out some of the other videos that I've done on the relationship between the upper neck, between the TMJ, between the rest of the spine on this channel. And you can check out a few other blogs and articles about how I can help you directly on my clinic website, clearchirospokane.com. Thanks again for watching. This is Dr. Jeffrey Hanna at Clear Chiropractic. Get well, live well, stay well.